Hello, everyone, and welcome to the very first episode of Health Unfiltered with myself, Dr. Jennifer Lococo. Here we will challenge the norm and break down the science so you can better understand your health. I'm really excited to kick things off with today's episode. Here at Lococo Wellness Clinic, we've recently introduced Prolozone and prolotherapy into our clinical offerings. I'm joined today by Dr. Khan, who recently took myself and members of our team through a comprehensive training day regarding Prolozone and prolotherapy. We're feeling confident in this approach and grateful to be able to incorporate it into patient care. In this episode, we'll be discussing his clinical experience, how these therapies are used in practice, and what patients should know when considering them. So thank you, Dr. Khan, for joining today to discuss prolozone and prolotherapy. So Dr. Khan, I've known you for probably like 5 years, 7 years now, I would say. Dr. Khan used to own a clinic in North York, and I was a patient of the clinic and did many ozone therapies there, and I loved it. And Dr. Khan has now taught us prolozone and prolotherapy. Dr. Khan, how long have you been in practice for?
So I graduated in 1992 from Faculty of Medicine, University of Toronto. I did my family practice training after that, and I finished that in 94. So yeah, it's been a while, almost 30 years.
A long
Yeah.
time. And how long of those years that you were in practice with your medical license were you practicing prolozone and prolotherapy?
Well, I didn't really find out about that until much later. The start of my practice was very traditional. As an allopathic doctor, I did some regular clinics. I did a lot of surgical assisting. I used to do palliative care, mainly for cancer patients. And it was when I opened a private cancer clinic in 2006. That's when I started to learn more about integrative medicine and naturopathic medicine. And only after that, really, it was around 2018. That's when I first actually learned about ozone therapy. Before that, I'd heard about it from different people, and it just sounded like something kind of weird, like quackery. You hear about it, you think, well, how can ozone be a medical treatment? Like, it just sounds strange, right? But what happened in 2018 was there was a patient of mine with the prostate cancer, a small localized tumor, went and got some ozone therapy and came back, and I got ultrasounds on him, and we actually measured. It seemed the tumor had completely disappeared. So then I had a new interest in ozone therapy, and I started
Yeah.
to research it a bit, and then I studied it formally under really the top two ozone doctors in North America, which is Dr. Frank Schallenberger and Dr. Robert Rowan. So it was 2018 really when I got started with that.
And out of all the treatments that you used it for, what surprised you the most? Obviously, the first case was very compelling for you because you're like, wow, that's a great result. But what other results did you see with your patients?
Well, probably the most dramatic use of ozone is this treatment called Prolozone, which you are now an expert in. And Prolozone is mainly, it's a treatment for chronic pain, but it's also a regenerative treatment. So it can help the body to heal locally, wherever you're putting the injection. And that is probably the most dramatic use of ozone. Because, well, let's say, I'll just give you one example, is when you injected my foot, when I came to your office, and what happened was I had kicked a punching bag probably a little too hard. I was just demonstrating some karate to some other doctors, and I aggressively kicked the punching bag. I think I broke my foot. I must have cracked something because it was swollen afterwards. I could barely walk. And then you injected it the next day, and the pain was gone. And then within the next 3 or 4 days, all the swelling went down. I was able to walk normally. So, I mean, that was really quite dramatic. I thought it was a significant injury. So that's one thing. Also for arthritis, osteoarthritis, we've seen some very dramatic results, like patients with bone-on-bone osteoarthritis. And we do the prolozone therapy, which is injecting ozone directly into the affected joint. And I've had patients cancel joint replacement surgery after doing
Wow.
these treatments. I mean, that's pretty dramatic. Also, we've had patients with chronic pains for years. And you think, somebody in pain for that long, this is going to be a really difficult case. Like, let's say a chronic back pain, for example, had scans, MRIs, maybe even saw surgeons, and the surgeon says, no, I don't see anything that's worth operating on here. You're just going to have to live with this pain, daily pain that's 7, 8 out of 10. That's really not fun. It really brings you down. And then there's no hope. People like that have to be on pain medication for life, according to allopathic medicine. We've had multiple patients like that where they reported improvements in their chronic pain with anywhere from 1 to 5 injections of prolozone.
And compared to standard conventional care, have you ever
Mm.
seen anything else that compares to what prolozone or prolotherapy can do?
There is nothing like it. I've never seen anything. Absolutely not. Not for these conditions that we're treating. Like these conditions, like let's say nerve entrapment pain or a chronic myofascial pain or a degenerative osteoarthritic pain, there is no cure for these things in conventional medicine. I'll give you an example. Like let's say you have a chronic nerve pain. There's a nerve that's been injured. Maybe it's formed a neuroma. The treatments for that are surgical, which would be to try to remove the damaged nerve. But then what happens is it still doesn't heal, and you end up with probably worse pain. Or neuroablative procedures where you're trying to destroy the nerve because the pain's coming from the nerve, and that can also worsen the pain, and it's not very successful. But on the other hand, prolozone can heal the nerve and improve the pain. So that's the difference between allopathic medicine and prolozone, which is still considered, alternative medicine and still considered by some to be quackery. It is often a solution for these chronic pains.
I can attest to that too, because when I had jaw surgery to remove the metal, because I went to Costa Rica, because nobody does it properly here in Canada, I had excruciating pain in the jaw. Even when I first had the jaw surgery, I had really bad nerve pain. And so, because of my experience at your clinic, I went somewhere else and did the injection
Mhm.
just because I had such good experience with all the experiments that we did in your clinic.
Yeah.
So I was very confident, and the pain was very, very bothersome, and it went away.
Mhm.
It was just great. It felt great. And then even when you came for our training day, it was still bothering me just a little bit, maybe a 3 out of 10, where before it was a 7 or an 8 out of 10.
Mhm.
And we just did another shot, and now I'm fine. Don't feel
Yeah,
it at all. So I
it's
can
amazing.
definitely attest to that. Yeah.
Yeah, absolutely. I mean, actually, I didn't even tell you when I first learned about ozone, I had an injury to my bicep, and I had pain here for probably about a year. And I was just putting up with it. It was an injury, and I had pain just lifting a glass of water. That's how painful it was. But I'm the type, I just kind of put up with things, and I just, oh, it's going to heal. It's going to heal. And you know how doctors are, right? They don't want to treat themselves.
Mm.
So I put up with it. I was in pain every day for over a year. And then that was around the time we learned about ozone. And so I said, okay, let me try it. I'll get an injection. And I had it injected, and the pain disappeared in, like a minute. Right. So I was so shocked that I didn't even believe it. I'm like, no, it can't be. It can't be. It just must be masking the pain. So after that happened, after the injection, I went to the gym and I said, let me try to provoke this pain to come back. So I grabbed some dumbbells and I started, lifting,
Yeah.
and nothing. So I'm like, okay, wait a minute. That's not enough. Let me do more. So then I grabbed the chin up bar. I did some chin ups. Let me put more stress on the bicep. Nothing, no pain. So one injection significantly improved pain. It was unbelievable.
I just love the potential. And I love to circle back to the patient where they were able to avoid a joint replacement. We have
Yeah.
a couple patients that we're treating right now that they're being told they either are going to need one or that they need one currently. And based off of what we discussed when you came for the training day, our goal is to achieve that same outcome. And thus far, it has helped with mobility, it has reduced the patient's pain.
Mhm.
So it's so exciting. So, that being said, let's get into how it works. So, can you explain a little bit about what prolotherapy is, what prolozone is in terms of the action that it provides to the tissues?
Yeah, sure. So ozone, I mean, most people, they've heard of the ozone layer in the atmosphere. This is the same ozone that we're using in the upper atmosphere. What happens is sunlight hits, ultraviolet light hits oxygen, O2, and it turns some of that into O3. And that's what ozone is. It's O3. So it's still oxygen, it's pure oxygen, but it's a different form of oxygen. It's a different molecule. And the difference is that O3, ozone, is more reactive, and it's also unstable. When ozone is formed, it lasts for maybe a few minutes or a few hours at the most, depending on the temperature and other factors. But it breaks back down into regular oxygen. The ozone is different when you inject it in the body compared to regular oxygen. When you put a small, precise amount of ozone, and it has to be precise. There's a range of concentration that is therapeutic. If you go too low or you go too high, it doesn't work. It's actually very well studied. When you put the ozone in the body at this very low concentration, it has a number of effects. One is ozone is an oxidant, so it creates this temporary oxidative stress on the blood, and that actually stimulates your body to boost your antioxidant system. So that's one benefit. The other thing is it reacts with your red blood cells and it improves their ability to carry oxygen. So when you ozonate the blood, you actually get more oxygen delivered to the tissues. So that's one thing. And also it creates other new chemicals in the blood and in the tissues by reacting with them. So it reacts with cell membranes, it reacts with fat molecules, with proteins, and it creates these new chemicals called ozonides. And they have their own healing benefits, including activation of your immune system. And in the case of prolozone, release factors. So those are natural proteins that your body has that stimulate healing, release of nitric oxide that's in your bloodstream, releasing stem cells as well. So again, stem cells, they can come in and they can heal the damaged area. And also, as I said, to boost your antioxidant enzymes. So there's a number of benefits from ozone. And we do prolozone. What we're doing is we're injecting the ozone directly into the area of injury or chronic pain. So when you do that, it can have very specific effects. In order to understand that, I think the first thing you want to understand is why is there chronic pain? So there's a number of things that happen in the body, especially with age, that can cause chronic pain. Like even if there's a slight injury, sometimes people get, it just doesn't heal properly, right? And then you get ongoing pain, which could last for months or years. So one of the things that happens is with the injury, it affects your circulation to that area. And the circulation going down, like from let's say the swelling and the inflammation, that reduces blood flow. So then reduced blood flow means reduced oxygen delivery, reduced nutrients coming to the area. Also, something that happens with age and with toxins from our environment, with many medications, is reduced mitochondrial function, which means the ability of your cells to generate energy is compromised. And that's called reduced oxygen utilization because the mitochondria use oxygen to burn sugar and create energy. So that's another thing that happens with injuries is, or let's say it exacerbates injuries, is reduced oxygen utilization. And then there's also some local acidity that forms as a result of all these things, and that just compounds the problem. So it's been very well studied, what happens with these chronic injuries and chronic pains. And then what ozone can do is it actually reverses all those things. So it improves the circulation to the area when you inject it into the tissue. So you can inject it into the muscle, the fascia, into the joints. That improves the function of the mitochondria, which means, again, the ability of your cells to generate energy. That's improving now. And then the cells will use the oxygen more effectively. And then with the improved circulation and with the prolozone mixture that you're putting in, which is the vitamins and all the other stuff that goes before the ozone, that also neutralizes the free radicals, reduces the acidity, and that also helps settle the inflammation in the area. And another thing is you can also get chronic infections in an area of injury. And so ozone treats that as well. So the ozone really help multitude of causes of chronic pain.
Okay, so to summarize the benefit of the ozone, so number one, we have antimicrobial, antibacterial, antifungal. So pretty much any type of infection may help to limit that or lessen. And a lot of the research too that you shared with us when we were training with you, there was one research paper that actually showed that there was a infection in a joint, like the joint replacement had to be removed. And the only thing that could help the infection in the joint was ozone treatment.
That was published by my teacher.
Oh, wow.
Yep.
Oh, wow. Okay.
Yeah, that's a world first publication. Those are extremely difficult infections to treat. So if you have a joint replacement, you have hardware, you have a foreign body inside your body. And that foreign substance, your immune system can't fully attack any infections, any germs that are stuck to it because there's no blood flow inside a hip replacement. So it's very difficult to treat infections of foreign objects that are inside your body. You have to remove them. And that's what they would do for an infected hip replacement. And for this case, the treatment didn't work, but the ozone helped. So that's a remarkable case.
Mm-hmm. And then the other action that does, because, and this is the way I always think about it, it's like I go to the osteopath all the time and I always had hip pain from my first car accident, and they would explain to me that it's because my main artery that's coming off the iliac that's going to the femoral that then ends up helping to feed the hip, they're like that blood flow is being compromised. And when the blood flow is being compromised, that joint is going to degenerate, and that's why you're getting the pain. So all my treatment when I'm working with the osteopath is they're trying to get the fascial tissues to release the tension on the blood flow so that I get better blood perfusion to the hip joint. And when I'm consistent with my treatment, my hip pain is not as severe. So just from that logic alone, if we're putting oxygen into the tissue and it's an oxygen depleted tissue when it's being degenerated, We're adding in the nutrients, so some minerals, some vitamins, because again, that's what the bloodstream is supposed to do. It's supposed to supply the joint with vitamins, minerals, nutrients to help it to heal, as well as the oxygen. And so any degenerated joint, you're not getting any of those nutrients anymore.
Right.
So that's the beauty of this treatment. I'm
Yep.
so happy to have this treatment, and I'm just so happy that we can offer this to the patient. And we're so grateful for all of your knowledge, Dr. Khan.
The ozone may help the degenerative process because it's
Right.
releasing your stem cells and it's releasing growth factors. And the stem cells, well, I don't know if your audience knows, but the stem cells are like the fetal cells, basically, right? And if you think about a fetus, well, where do we come from? We come from a single cell, and then that becomes two, and then four, and then eight, and so on. And then those cells, which are initially all the same, they form skin, nerves, bone, heart, stomach, right? So those primitive cells can turn into anything, and that's what the stem cells can do. So your stem cells can pretty much form anything. So when you get stem cells released and they come into the area of damage, then they can help heal it.
And that's why the research, again, that you shared with us, we're seeing that it's improving Achilles tendon, not a full tear, obviously, but if it's any partial tear
tears.
to tendon, ligament injury, the fascial injury, plantar fasciitis. There was really good research with the plantar fasciitis. And then, like you said, rotator cuff injury or bicipital injury.
Yep.
And then myself personally, we injected my feet and have so many issues right now with my feet. And it like honestly was amazing. Nothing worked that well for any treatment that I've done, and I've done it all. And just the difference and the improvement is just so promising. So very excited.
It really is remarkable. It is so remarkable that if you tell allopathic doctors about it, they will not believe you. You kind of have to experience it, right? So we've both experienced it more than once. And of course, the research is there as well. You know, you have to go looking for it. But the problem is that allopathic doctors, it's not part of our training. So unless they go looking or somebody tells them about it, they're not going to know about it. And then if somebody tells them about it, they're just not going to believe it either because it sounds too good to be true.
And I would say that applies to so many things, not just prolozone, prolotherapy, but I mean, for a plethora of other treatments.
You're right.
But yeah, specific to this treatment, I don't think that I think the only thing that some medical doctors are starting to realize is the benefits of PRP injection, which you also taught us as well. So I would say there's a lot more medical doctors, if they're thinking outside the box and they don't want to do the cortisone injection, and they realize that the hyaluronic acid might not going to regenerate the tissue, then they're going to offer the PRP. But I'll say this even for my foot, to me, I wanted to do prolozone prolotherapy first because you may get that pain relief, you get that reduction in inflammation. Whereas when I tore my meniscus 2017 and I did a PRP injection, I was in excruciating pain for a week. I couldn't walk, I couldn't drive afterwards, which yes, over time it helped to heal the tissue, but you get an instant more inflammation because that's how it works.
That's how it
right?
works. So that's a really important point because we've seen many people who were treated with plain PRP for either sports injury or osteoarthritis by some of the top sports medicine people. And the PRP did not work. And then they came to us. Somehow they found me. I don't know. We don't advertise, but they found me. And we treated them with ozone, prolozone, with or without PRP. But prolozone was the main treatment, and it worked. So that's even after PRP failure. So I can say this with confidence based on our experience. If you're going to compare prolozone and PRP, just one or the other, the prolozone is far superior. But for your difficult cases, if you combine prolozone and PRP, there's really nothing like it. It's quite remarkable. And even it's in some ways better than stem cells because, as you say, it can give immediate pain reduction or pain elimination. So there's really, I've not seen anything else that works this way.
It's just shocking how this is not first-line therapy.
Yeah. And another important point that, I think your audience needs to hear this is that there's a number of people who are advertising that they're doing prolozone, right? They'll use the word prolozone and say they're doing it in their clinics. But when you actually find out what they're doing other things. They're not using the correct local anesthetic. They're not using the correct mixture. They don't know how strong ozone they need to put in the joints or in the tissues. And we've had, our patients go other places and come back and say, we're never going back there again because either the procedure was extremely painful, which it shouldn't be, or it just didn't work, or they got overcharged and had no results, So I highly recommend that people consider you because now you've been trained properly. And I know that because I've trained with the top ozone people in North America.
which is amazing.
Yeah.
And I'm so, so grateful for your knowledge. For anybody that is listening to and that is interested in getting trained on this therapy, Dr. Khan, you're traveling all throughout Canada and United States to train,
I
correct?
am. Yeah.
Okay.
Yeah.
Okay. So any practitioners are interested, and we'll put all of your information in the podcast notes so that if they're interested, they can reach out to you to receive the training.
Exactly. You need to be trained properly. If you start doing shortcuts of the techniques, you're not going to get the same results. It's really important to do it correctly. And so now, I mean, you have the expertise. And what I've heard already is that your patients that did the treatment while I was with you reported phenomenal results. So it is really important to do the techniques correctly.
Yeah. And just to add to that note before we wrap up, the one research paper that you put in our resources when you were training us was a paper where they were comparing the, like you said, the dose of the ozone, so the
Mhm.
strength. And they did one in a low dose, they did one in a high dose, they did one in a medium dose, and they found the low dose doesn't really do anything.
Mhm.
And the high dose actually increased inflammation. So
Yes.
that's your point
Yes.
that it can actually be harmful when not done properly.
Exactly. And the difference between the low dose and the high dose is actually not that much. So not only does the practitioner have to know what dose or what strength to use, but their machine has to be the proper ozone machine of a high quality machine like the one you have. And then it has to be, properly calibrated as well. And so yours was perfect. You did my foot and we did all those patients together and excellent results. So all of these little things matter. And so, I would just want to emphasize that because people should go to somebody who's properly trained like you.
Amazing. Okay, Dr. Khan, thank you so much for taking time of your very busy schedule to educate everybody further and share some of your wisdom. And thank you again for training us. We are so excited to be offering this treatment. I personally just signed up for it because I needed it for myself. And
Mhm.
that's pretty much the way the story goes, right?
Yeah.
It's either a loved one, yourself, or maybe like a patient that you have really good rapport with that you're searching for other answers or other solutions or other treatments, and then you want to adopt that and bring it into your clinic. So that was definitely my experience. So I'm very grateful to have met you and to know you and to learn from you. So thank you.
Thank you. It's a pleasure. Happy to pass the techniques along. And now I know you'll be able to help many people.
All right. Thank you.